you have on the page depigmented skin and the form. Both of them, all of them were having a good direction. We started with circumferential subcoronal incision, and we started to develop the skin, the shaft of the skin. Now, the challenge of the surgery is here to get to the proper plane. And we have found that usually the silicone is superficial to box fascia. So when you get to the box fascia, you just have to continue dissecting until you develop the whole skin down. So we succeeded here to develop the skin, and the skin is there, and it's very important to move as much as possible the granulomatous tissue that's around the box fascia. Here we are trying to get squeezing the paste. This is a silicone paste that's infiltrated by a layperson, and unfortunately we decided to remove the whole skin because it was useless and we could not use that skin. So now we have a shaft without any skin, and this silicone paste was migrating to the scrotal region also that we had to remove. We decided to take and do a two-stage penile skin reconstruction. The first stage was to have a subdarcus scrotal tunneling. We measured the length of the stretched penis, and we created this tunnel according to the size of a stretched penis. And now we are opening a buttonhole at the proximal end. So this is for getting the glans penis out, and usually we are using the longitudinal incision for doing this step because we found it's much easier to get the glans penis out of this buttonhole. So you see that the shaft of the penile skin is clear now from any granulomatous tissue and any fibrosis. The proper sizing of the opening of the buttonhole is decided here, and we are getting the glans penis out. And usually this step is very easy. Most of the time that we spend in this first part of the surgery is to get into the proper dissected plane. Here you see that the shaft of the penis is buried and embedded in the scrotum, and the size is also proper. And this is very important because if the length is short, this will cause a problem in the second step. And if it is again short, the patient may report that he is having pain during erection because we will allow a period of 3 months for the flap to be taken. So this is the final step. This is the skin that we have removed, and this is the silicone that was injected. We have melted out. So this is the skin growing of the first step, and this is the second step. And we have waited for 3 months for the flap to be taken. So this is the picture of the same patient after the 3 months of the first step. So the flap, when we take it, it's very important to have the same length of the girth of the penis. And this is usually done very easily by holding the shaft of the penis, and you take it from each lateral side, and you see that how nicely now the scrotal flap have been taken, and you can easily dissect this step, and you can just pull the skin down, and you can get, this is the final step when the two testes is out of the scrotum, and we are deciding about the first stage, The first stitch is usually very important because this will decide the length of the penile shaft also. Now the penile shaft is wrapped ventrally and it's closed in 2 layers, and the testis is back to the scrotal sac. This is the final of the second step. Before the second step, they needed penis for 3 months, and then this is the final result. Usually the patients are very happy about the length of the penis because they don't have the web, and this will give them a quiet satisfaction. Thank you very much.
Thank you, Dr. Johnson. Any questions? Question here. Can you please identify yourself, name and institution?
Hello, Paul Anderson. As I was told, have you tried single stage midline minor scrotal collapse?
Thank
What do
you.
you think of that?
Yeah, thank you very much for this question. We did not try the single step actually. And this is because I have talked with my colleagues, my plastic surgeon colleagues, and they have advised me to do it in 2 steps for a reason, because this silicone, the fibrotic area that we have, I was afraid that the flap will not take. And I had to shave and I had to prepare the bed properly for a 2 step. This was the main reason. But if you have lost the skin and the bed is clean, I think you can consider the 1 step procedure.
Just to congratulate nice presentation. This is a nice technique published also by Dr. Zuki. Very similar method for reconstruction of penile skin. And I studied that we did a lot of cases in 1 stage reconstruction of penile skin using scrotal flaps, and the result is always good. It's just important to form nice and proper flaps, because scrotal skin must be carefully dissected. Scrotal skin has very nice and thin darkness, the same like penile skin, but it is attached to the testicular fascia, so to the septum. So we must separate, and we must mobilize very thin skin to preserve vascularity, of course, because it is separate vascularity from this deep vascularity. And after this wide mobilization, it's not easy at all to reconstruct penile skin.
I have to say that this operation, I mean, I think the operation that you guys have just said, where you rotate the scrotal flaps, that's quite a delicate procedure. I mean, this, to get out of jail, this is an easy procedure.
Yeah, it is, but also this one is not difficult at all if you understand vascularity of scrotal skin.
It's not easy to do, I know it's not easy. But in general, the general urologist, when they come across this operation is very straightforward and simple. Clearly, for a reconstructive surgeon, like the 2 of you, then 1 stage procedure is
Exactly. I found this is quite easy for any urologist to do that. And the good thing in this that you get the darkness, because you need the darkness for a stretch the penis during erection, and the skin is very